Lawmakers questioning the deductions in the health department's proposed budget for next year. Quezon Representative Helen Tan points out the DOH has only the fifth highest budget amid the COVID-19 pandemic. Let's bring our Carolyn Bonkin for more on this. Carolyn?
Yes, Pia. Congresswoman Tan said the COVID-19 pandemic should have been a wake-up call for economic managers to prioritize the health sector. A number of lawmakers raised budget cuts in the health department during the budget briefing. Kabataan Party List Representative Sarah Jane Ilago questioned the budget for environmental and occupational health and for blood center operations, which was less than what the department proposed. Health Undersecretary Mirna Kabutahe said they asked for 154 million pesos for environmental and occupational health for 2021, but only 2 million pesos was granted to purchase reagents for water laboratories. They're supposed to use the money for additional sanitation facilities, especially in Metro Manila, Central Luzon, and Calabarzon. Bayan Muna Representative Carlos Zarate also questioned the low allocation for the Lung Center of the Philippines and the Philippine Children's Medical Center, which are specialized hospitals. Health Undersecretary Mario Villaverde said the budget department approved an amount lower than their request for these hospitals. Zarate also pointed out more budget cuts in a key function of the health department in the middle of this pandemic, such as the epidemiology and surveillance capacities.
Are these programs not important and related to also sa issue ngayon ng COVID-19 pandemic?
Totoo po na yung ibang mga line item ay nagkaroon ng bawas. Ito po kasi yung binigay sa aming ceiling ng DBM. At ang sabi, i-propose na namin yung mga kakulangan sa Tier 2. Pero hindi po lahat ay napagbigyan sa Tier 2 ng aming request.
Congresswoman Tan has appealed for the plenary's support to restore the budget cuts. Back to you.
Well, Carolyn, did the Congresswoman name the programs that need a boost in funding?
Yes, Pia, Congresswoman Tan mentioned a number of programs, including the Health Facilities Enhancement Fund. She said only 4 billion pesos was allotted for equipment and ambulance, but there was no budget for infrastructure. She also pointed out the need to increase the fund for COVID response, such as for testing facilities and information technology infrastructure.
Malaking problema po natin yung nangyari, no, na ang reporting natin ng cases ng COVID ngayong pandemic ay marami ang tumutuligsa sa Department of Health because of they find it very inefficient ang Epidemiology Bureau. Pero kung mapapansin po natin, ang dahilan talaga wala pong robust IT infrastructure ang DOH.
The Health Department initially asked for 188 billion pesos for 2021, but only 127 billion pesos was approved. Yeah, so far was included in the initial NEP. Yeah.
Carolyn Bonkin there reporting.